Outstanding Rural Educator and Mentor Award, Billie Madler. Dr. Billie Madler is the Chair of Graduate Nursing Education for the University of Mary in Bismarck. Her contribution to North Dakota's rural health care is demonstrated through her dedication and advocacy of developing nurse practitioners prepared to serve as primary care providers in rural health.
I've known Billie for a really long time. She actually is a graduate of University of Mary and was in one of our first nurse practitioner classes here as a graduate student. And through all of this time, as her practice in emergency room, her faculty positions here at University of Mary, and then personally as an educator in our university, the word that I would describe is passion. She has a tremendous passion for her students and for her patients and for knowledge. And so you put those three things together and you have someone who is always and full of energy, working toward what can be the best possible outcome for each of those populations.
One of her most recent achievements has been leading the University of Mary in Catholic health initiatives, north in obtaining and executing a $1.1 million grant from the Health Resources and Services Administration. The grant was innovative in its emphasis on developing curriculum for the rural healthcare family nurse practitioner.
Dr. Madler is an exceptional educator, and she's also an exceptional nurse practitioner. She is a person that I think each of us students of hers have tried to become like, or she's a person that she's a role model to all of us, and she has done so much for the nurse practitioner profession that we all should be grateful for her.
Through her role with the university, Dr. Madler directs 6 majors and has been instrumental in the development of not only the curricula of these programs, but also responsible for enrollment, faculty, scholarships, service, teaching, and budget. To foster opportunities to practice in rural settings, she has integrated a clinical program into the curriculum that sought out preceptors in rural health clinics and critical access hospitals where students were assigned for clinical placement.
Being born and raised in an urban area, I've had little to no experience of rural medicine, and being able to go into a rural health facility and see it firsthand was absolutely fantastic, and I would like to thank Dr. Madler for her tremendous contributions to my growth personally.
She challenges us, she motivates us, she has so much wisdom, experience that she really just wants us to do well, and anything that she can instill in us has been greatly appreciated.
She worked to prioritize rural needs by advocating for clinical rotation placement. She continuously pushes her students to learn how best to work in rural facilities. Dr. Madler demonstrates the utmost commitment, mentorship, and leadership to her students and colleagues, and to the public throughout North Dakota.
Hi everyone, this is Dr. Billie Madler from the University of Mary, where I serve as Chair of Graduate Nursing Education. I want to thank my nominators for putting my name forward for this award, and certainly am humbled by being selected, as I know there are many, many deserving people. I want to thank my faculty, who I am a huge cheerleader of, and who work their tails off to make sure that we ensure excellence and that we prepare students who are going to be high quality providers in the communities that they choose to practice. I want to thank my students who we challenge to the brink and who rise to the occasion every time. I want to thank my family for their enduring support and their inspiration that they provide me, and their tolerance of a lot of sometimes long days. And I want to particularly thank rural health communities and healthcare organizations in those communities, including the leaders, staff, and providers of those facilities. We send many, many of our nurse practitioner students to gain experience in rural health clinics across North Dakota and across the region. In fact, we require a rural health experience in our nurse practitioner program, and students find they're embraced by these communities and the providers and the staff in these clinics. They're challenged by the patient case mix and presentations, and they're really required to stretch their critical thinking and medical decision making, where sometimes there's not every resource that you might have in a more urban setting.